A healthy 18-year-old man died playing basketball after drinking 2 cans of Red Bull. Let's take a closer look at some of the main health hazards associated with energy drinks. Long-term effect. Unfortunately, there are no long-term studies of the effects of caffeine, taurine, and glucuronolactone on the body. In one study, 15 healthy persons aged 18 to 40 years consumed 2 cans, that is 500 ml of a commercially available energy beverages containing 1000 milligram of taurine, 100 milligram of caffeine, as well as vitamin B5, B6, B12, glucuronolactone, and niacinamide daily for 1 week. Effects of the energy beverage on their blood pressure, pulse, and ECG were measured. So let's delve into the health risks associated with energy drinks, short-term effects and long-term effects. Short-term effects. In addressing the question of safety, it is important to consider both short-term and long-term effects of taking energy beverages. The physiological effects occur immediately after drinking the first dose. In one study, 15 healthy persons aged 18 to 40 years consumed 2 cans, that is 500 ml of a commercially available energy beverages containing 1000 milligram of taurine, 100 milligram of caffeine, as well as vitamin B5, B6, B12, glucuronolactone, and niacinamide daily for 1 week. Effects of the energy beverage on their blood pressure, pulse, and ECG were measured. The key effects were as follows. Within 4 hours of beverages consumption, the maximum systolic blood pressure increased by 8% on day 1 and 10% on day 7. Within 2 hours of energy beverages consumption, the maximum diastolic pressure increased by 7% on day 1 and 8% on day 7. Heart rate increased by 8% on day 1 and 11% on day 7. Throughout the study, the heart rate increased between 5 and 7 beats per minute, and systolic blood pressure increased by 10 millimeter of mercury after consumption. Although no clinically important ECG changes occurred, there were significant increases in heart rate and blood pressure, and therefore the patients with hypertension should not consume this type of drink. And several case reports on the immediate effect of such beverages ingestion have been published. 4 documented cases of caffeine associated deaths have been reported, as well as 5 separate cases of seizures associated with consumption of energy or power drinks have been reported. An otherwise healthy 28-year-old man had cardiac arrest after a day of motocross racing. A healthy 18-year-old man died playing basketball after drinking 2 cans of Red Bull. Postural tachycardia syndrome associated with a vasovagal reaction was recorded in a young volleyball player after an excess intake of Red Bull as a refreshing energy power drink, leading experts to suspect the drink as a possible cause of orthostatic intolerance. Further cases of psychiatric effects on patients with known psychiatric illnesses were reported. One case of suspected anaphylaxis was reported. There is also a concern of dehydration. Regarding fluid replacement in persons who do not typically ingest large amount of caffeine, energy beverages deliver a considerable amount of caffeine, which can stimulate the kidney to produce more urine. Therefore, energy beverages can have a net dehydrating effect. A rising number of patients, many of them young people, are being treated in the emergency rooms for complications related to highly caffeinated energy drinks like Red Bull, Monster Energy, and 5-Hour Energy. The new federal data shows the number of annual hospital visits involving the drinks doubled from 2007 to 2011, the latest year for which data are available according to a report by the Substance Abuse and Mental Health Service Administration. In 2011, there were 20,783 reported emergency room visits in which an energy drink was cited as the primary cause of or a contributing factor to a health problem, compared with 10,068 in 2007. Such problems, which are typically linked to excessive caffeine consumption, can include anxiety, headache, heart palpitation, heart attack. Therefore, the consumption of energy drinks is not without risk. The high levels of caffeine and sugar combined with other ingredients can lead to a range of health issues. And these health risk can range from mild to severe. They can affect various aspects of your health, including your heart health, mental health, and overall well being. So, it is important to be aware of these risks, especially if you are consuming energy drinks on a regular basis. Let's take a closer look at some of the main health hazards associated with energy drinks. Long term effect. Unfortunately, there are no long term studies of the effects of caffeine, taurine, and glucuronolactone on the body.